Hey, it's Ashley from Demystifying Your Health. Welcome! Today we're going to be talking about sleep apnea. When you hear the words sleep apnea, you probably think of snoring. While this is true, especially for family members who have to deal with it and it's annoying, did you know that sleep apnea is actually a serious medical condition? So how do you know if you have it? And more importantly, how is it treated? Sleep apnea occurs when you stop and start breathing while sleeping. There are three main types: obstructive, central, and complex. Obstructive is the most common, and it occurs when the muscles in your throat relax. This causes your soft tissue, such as your tongue, the sides of your throat, tonsils, and uvula to get close together, which narrows the opening that allows air to pass through. For some people, it actually closes off completely. This results in a drop in your oxygen levels within your body, which signals to your brain to wake you up so that way you take a breath. Most people aren't aware of this and don't remember being woken up. Unfortunately, this pattern repeats multiple times a night. Central is less common and occurs when your brain doesn't send signals to your breathing muscles for you to actually take a breath. Complex is a combination of the first two. Regardless of the type you have, the symptoms are the same. While snoring loudly is often a symptom, it's not always present. Some other ones include a dry mouth, a headache in the morning, insomnia, daytime drowsiness, fatigue, and irritability. Anyone can develop sleep apnea, even children. The risk factors are different for each type. For obstructive, if you have a thickened neck, are overweight, have a narrowed airway opening, are male, elderly, have a family history of the disorder, use alcohol or sedatives, you smoke, or you have chronic nasal congestion, your chances of developing sleep apnea are higher. For central, if you're elderly or male, have a heart condition, a history of stroke, or use narcotic pain medication, your chances are higher. For complex, it's usually a combination of factors from either one of the groups. Complications are numerous. And these are just a few of the examples. The first one is falling asleep during the day. While this might not seem that great, especially, it can impact job performance, it can be incredibly dangerous if you fall asleep while driving a car. Another issue is due to the drop in oxygenation while you're sleeping, it can increase your blood pressure, which increases your chances of having heart problems, stroke, and numerous other things. One of the things our body does while we're sleeping is regulates our glucose levels. So when you get poor quality sleep, as is the case with sleep apnea, you're at increased chance of developing insulin resistance, which if you have this, you're more likely to end up with diabetes. To treat sleep apnea, you need to know what type you have. For mild cases, the recommendations are to lose weight, stop smoking, and controlling your allergies. For moderate cases, you'll need a CPAP device. CPAP stands for Continuous Positive Airway Pressure. What this means is that air is being forced into your air passage to help keep it open. This is done by wearing a mask while you're sleeping. There are many different styles of masks. Some just cover your nose, while others cover your nose and mouth. So if one's uncomfortable, there's plenty of options to try until you find one that is less uncomfortable. Your doctor will help you determine what settings the device needs to be on. If for some reason this isn't working, or you have severe sleep apnea, you'll need surgery. This can include tissue removal, tissue shrinkage, implants, jaw repositioning, or creating an entirely new airway passage. There are several things that you can do to help prevent sleep apnea. The first is to lose weight or maintain a healthy one. You can do this by getting 30 minutes of exercise most days of the week. Just be sure to check with your doctor before you start any new routines. The next is to not smoke. This is one of the key ones because smoking can severely impact your airway passage. Another tip is to not sleep on your back. Instead, try sleeping on your side or on your stomach. This will help prevent your tongue from falling back and closing off your airway. And the last one is avoiding alcohol or any other sedatives because these can relax the muscles in the back of your throat, which make it more challenging to breathe. Sleep apnea is more than just snoring. It's something that needs to be addressed to prevent other serious medical complications. Stay healthy.